Welcome back to Take 5 and Company. It is the 13th of the month, and that means it is time to do your breast self-exam and call your friend for life. Have them do the same. Very important, early detection, obviously big part of the cure. And joining us today, Dr. Mark Haas, who is Medical Director and Radiologist at Mercy Health Comprehensive Breast Center in Muskegon, and Dr. Jamie Caughran, Medical Director and Fellowship-Trained Surgical Oncologist at Mercy Health Comprehensive Breast Center in Grand Rapids. Good to have you here.
Thank you.
All right, so you guys have all the bells and whistles, and this is important because we know so much about grabbing it early and getting an early intervention, right? This is the key.
Correct.
Absolutely. So in Grand Rapids, we've got this 3D mammography, right?
Yep.
Tell me about what that is.
So tomosynthesis is, in lay terms called 3D mammography, where it will look and feel much like a regular mammogram with a 2-view compression on each breast. But instead of just taking 2 static views, it actually will scroll through the breast tissue when the breast imagers read the images. So it will help prevent overlapping tissue causing artifact. So we're hoping it will reduce our callback rate and also increase our cancer detection rate for solid masses.
So is for the patient or the person having the test done, there's no difference in the experience, it is the outcome of that examination, right? So that women don't have to think you're going to take a million different shots.
Nope, it should be a very similar experience, and we're really targeting ladies that are either at elevated risk at baseline or people that have increased breast density, which we'll be working on notifying women of when they come for their annual screening mammogram.
So with their physician, they will figure out if they fall into those categories and need to have this more advanced 3D look at the breast.
Sure, and if you're not sure, just feel free to ask your mammo technicians when you come to have your mammogram performed, and we can help get that information for you.
Breast density, help me understand the importance of that piece of it.
Well, I mean, certainly we know that there's a correlation between those women who have more dense breast tissue and the frequency with which they may have breast cancer. About 1 in 8 women in the general population will have breast cancer, and about 1 in 5 women with dense breast tissue will be likely to get breast cancer, and the reason is because the more functioning breast tissue there is, the more tissue that's susceptible to the disease. So we want to know about a woman's breast density so that we can better predict, how we may need to screen her as we go forward.
Now in Muskegon, you guys have something called ABVS. What does that stand for? Because this is big technology too.
So we are going to be launching automated breast volume scanning, also called automated whole breast ultrasound, in probably January of this year. We're working with the technology right now. The idea is that as part of Mercy Health, we want to be able to offer a modality that we can screen women with dense breasts or women in a high-risk category that doesn't necessarily involve radiation. So with ultrasound, it's sound waves. It's another way to look at the breast. Most women are accustomed to handheld ultrasound. This is literally an automated device where we take images from 3 different angles per breast, and then it allows us to take that data, feed it into a computer, and reconstruct it in different projections so that we can also look through dense breast tissue in a different way and hopefully pick up cancers that we can't pick up on a mammogram where everything's just white on white.
Obviously, both of these pieces of technology result in better outcomes for patients, ultimately.
That's the goal.
That is the goal. All right. Well, if you'd like to find out more information, you may do so. Go to our website, WZZM13.com. And right now, we want to give you a chance to win one of our brand new 13 Friends for Life stadium blankets. The first 13 callers to get through to us at 616-784-TAKE will take one home. We'll be back.